Hello, my name is Tim McCurdy, and I am an elder law lawyer practicing in St. Louis, Missouri. I'm often asked, what is elder law? What does an elder law attorney do? And one of the main roles that an elder law attorney serves is to help individuals find ways to overcome and pay for the incredible cost of long-term care. If you or a loved one has gone through the experience of trying to find a place that's right for you or your family to age and begin to receive care, you know how incredibly expensive this can be and how difficult that can be for families to pay for that care. So today we're going to talk about how people in America pay for the cost of long-term care. And this is becoming an incredible problem for a significant part of our population. And the reason for that is what we call the silver tsunami. Every day, 10,000 baby boomers turn 65. And while 65 certainly doesn't mean that individuals are in need of long-term care, in fact, it oftentimes anymore doesn't even mean someone's retired. But what it means now is that we have a significant part of our population that is aging in place, and that over the next 10, 20, 30 years, they are going to be placing an incredible strain on the long-term care infrastructure in our country as this group of individuals ages together and starts to require more care. And when we talk about 65, the reason that we talk about 65 is because in the 60s and the 70s, when many of the government benefits that are available for seniors were being created, 65 was close to a person's life expectancy. The idea was, you would work your whole life, you'd pay into the system, you turn 65, you'd have a few years of for your life expectancy, and then you would pass. So the government would only be paying benefits for a short time. Now, fortunately for all of us, we're living much longer than that now. From 2007 to 2030, the number of people in Missouri who will be 85 years old or older is going to nearly double. It will increase by 48%. So we have the combination of the baby boomers who are aging together, so we have a large part of our population, and then it's reasonable for them to expect to live much longer, into their 80s, and so we have this large part of our population that is going to be requiring care over a longer period of time. And when we're talking about elder law and we're talking about long-term care, often we're talking really about where will the senior live, and as someone ages and they begin to require additional care, how are they going to receive that care? And it's a spectrum. Most people don't just go from living in their home perfectly fine one day to the nursing home the next. There are many different potential places that individuals can live or receive care, and also increasingly as the needs arise and as people see this population that's growing, the options are increasing. And oftentimes the first step may be independent living. So this is senior apartments, areas where individuals can avoid the isolation of living at home and be living in more of a community setting with individuals who are of similar age and similar interests. Now, as a person's care needs begin to increase, they may progress to assisted living. And the idea behind the assisted living is to still have that independence, still be closer to an independent living scenario, but as an individual begins to have greater needs, they can get some of those needs taken care of in assisted living. And for many of us, I think that our first choice would always be to age in our own homes. That, ideally, if we could choose, we would say that we would remain in home, but as we need to get care, we could have that care provided to us in our home by home health aides. And finally, unfortunately, there's the nursing home. And I'm sure most of the people watching this video will say either, I'm not going to go to the nursing home, or, that's certainly most people, it's not their first choice to go to the nursing home. Now, unfortunately, as a reality of aging, sometimes we reach a point where we simply have too great of a need for care, and we need that 24-hour care that's provided in the nursing home setting. So how do we pay for this? How do most people in America pay for the cost of long-term care? And really there are 5 ways that they can pay. There's private pay, there's long-term care insurance, the Veterans Affairs, Medicare, and then Medicaid. So the first option is private pay. So naturally, if you have the financial resources, or your family has the resources, then you're going to have the most choices about where you can live, because you're going to be able to pay for that yourself. Also, private pay may be the only option for independent living or an assisted living facility, because there may not be any government benefits available to pay for the cost of those living situations. Now, the problem with private pay, of course, is that long-term care can be prohibitively expensive. So it could easily cost, up to $8,000 a month to have a nursing home bed in St. Louis. So, and it can be greater if you have some form of, memory care need, and dementia or Alzheimer's. So you can see where if an individual can work their entire lives, save up for their golden years, and go through that very quickly if they have to have an extended stay in a nursing home. Now, when we talk about the baby boomers and we talk about this, significant part of our population that is aging together, this isn't a surprise. For my entire adult life, people have been talking about this coming silver tsunami, this group of individuals who are going to reach, advanced age together and have care needs at the same time, which is going to place a great strain on the system. And the answer was supposed to be long-term care insurance. And in the 1990s, there were over 100 insurance companies that were selling long-term care policies. The idea being that the private market would respond, recognize this need, and they would serve this population by providing insurance. And today, there are less than 15 companies selling traditional long-term care insurance policies. You say, how is that possible? The need has increased, and the number of companies selling the product has actually decreased significantly. And to think about that, you have to think about how insurance companies operate and how they are profitable. They are making projections. When they're underwriting a product, they're anticipating what the cost is going to be, out of how many policies they sell, how many will they pay out benefits on, how long will they pay out benefits on. Insurance companies also calculate a certain number of policies that will not be renewed over time. And you may think, well, that's a bad thing for the insurance company, their policy isn't being renewed. But remember that that's a scenario where a person has been paying for the policy, and then before the insurance policy actually pays anything out, they cancel the policy so the insurance company doesn't have to pay. And what they found, these companies that were writing long-term care policies in the 90s, was that as people started to actually use this product, it was much more expensive than they anticipated. So they hadn't been charging enough in the 90s to pay for the cost of care when people started to use these products in the mid to late 2000s. The other thing they found was that people weren't canceling these policies. While they had calculated a certain percentage who would cancel it, the number of people who canceled their long-term care policies was actually lower. So people were holding on to their policies, they were actually using them, and the cost was much higher than anticipated. Now, the long-term care policy companies or industry, they've responded, and you may, when you're talking to your financial planner, you're talking to your insurance advisor, they may discuss with you a hybrid insurance policy, which is actually a life insurance policy that has an additional rider that can provide some long-term care insurance. And that helps address one of the other problems with long-term care insurance, is that while you're planning for the future and you certainly may need long-term care, you also may not. So you may be paying for what's considered rather expensive insurance and then never actually get a benefit. So they've created these hybrid policies where you get a death benefit, but it can be reduced by an amount for long-term care. If you need long-term care, that is paid for, but it decreases the death benefit. If you don't need the long-term care, then you're leaving something to your loved ones when you pass away. Another option would be Veterans Affairs benefits. If you or your loved one served in the military, or if your spouse served in the military, then there may be benefits available to you. And for the benefits that are available for veterans, there are certain service-connected benefits. There's, for example, service-connected compensation, which is similar to a form of workers' compensation for veterans, where if they have a need for medical care, it has to be service-connected. It doesn't have to be that they were injured fighting in a war, but it has to be that the injury that they've sustained is in some way connected to their service. Now, there can also be survivors' benefits if the service member has a death that's related to their service, then there are benefits for their survivors. But in the area of long-term care, one of the great benefits that can come from the VA is what they call the Improved Pension Program. So this is a need-based program where the VA is paying out an actual cash benefit every month based upon an individual's income and assets and their medical needs. So this can provide, it's intended for veterans to make sure that their basic essentials are being met, and it can provide for up to $2,800 a month in actual cash going to the veteran or the veteran's family. And this can be an important benefit because remember we talked before about independent living or assisted living and scenarios where the other benefit programs may not pay for those. Here you're getting cash to be used for your care. But keep in mind that this is what we call a needs-based program. So it's going to be based on your assets and your income. And there have been some significant changes in VA benefit programs in the past year. As again, you have this increase in individuals who are aging, so you have greater demands being placed upon government benefit programs. And one thing we find is the response to that, as we're not increasing taxes to cover the increased costs, so one response has been to tighten the eligibility requirements for those who can receive benefits. So in the VA pension program, they have instituted some additional restrictions that include what we call a 3-year look-back period. So the look-back period is something that has been established for many years in Medicaid that talks about your eligibility when you are applying and identifying your assets and your income. They're going to look back over 3 years' time to see if you have transferred any of your assets away. The idea being that you can't just give away your assets or put your assets into a trust and say, well, okay, I don't have anything anymore, so I should qualify for these benefits. And there's also penalized transfers, formal income, and asset limits. So the VA pension program is looking a lot more like Medicaid, which we'll talk about here in a minute. The other way that long-term care can be paid for is Medicare. But this is a source of constant confusion as people are beginning to look at their options for paying for long-term care. Understand that Medicare does not pay for the cost of the nursing home. And when I say this, people respond and say, well, wait a minute, what are you talking about? My mom was in the nursing home after she had a fall and it was paid for by Medicare. Or, my sister was, when she passed, she was receiving hospice care at the nursing home, and that was being paid for by Medicare. And understand that those are unique circumstances where Medicare does pay for types of care that happen to be provided in the nursing home. But when we're talking about the nursing home, skilled nursing facility care, what we're talking about is care for chronic conditions. And the way to think about that is Medicare is health insurance. So its goal, the reason you receive Medicare benefits, is to get treatment in order to cure your ailment. So, if you have hip surgery, Medicare pays for that, for you to have the surgery to treat your hip condition and then to get better. As opposed to when you're receiving nursing home care and you have a chronic condition, it's not something that you're being treated to have fixed, it's just something that you are dealing with that you need constant care for. So in Medicare, the confusion comes from the fact that you can be having certain services performed at the nursing home that are paid for by Medicare. Again, is something that they will pay for rehabilitation, and this is something to get better. It's not, so each time when you're getting that care, the physician has to certify that the purpose of this treatment is to improve your condition. It's not just, you'll benefit from this therapy because it may ease your pain or, improve this chronic condition. It's that, you're improving your ability to walk after a fall or something like that. And to have Medicare pay for this rehabilitation, it has to be preceded by a hospitalization of 3 days. So Medicare, you could say the classic example being someone has a fall, they suffer a fracture, maybe they have surgery, and then they need rehabilitation to help get their strength back to improve their walking. So they're in the hospital for their surgery, and then they are discharged for inpatient rehabilitation at a nursing home. And Medicare is going to pay for part of that care. For the first 20 days, Medicare will cover the cost of the rehabilitation in the nursing home 100%. They pay for everything. So that's where a lot of the confusion comes from, to say, well, wait a minute, Medicare pays for the nursing home. And then it decreases. They will pay 80% for the next 80 days. Then after that, after 100 days, they're not going to pay for any of the inpatient rehabilitation. The idea being that after 100 days, you're not still getting rehab, you're becoming a nursing home resident that needs that level of chronic or continuous 24/7 care. And then also we mentioned hospice care. So when someone is determined by a physician to be terminally ill, that they have an expected life expectancy of 6 months or less, then they can qualify for hospice. And Medicare will pay for hospice. And when we hear hospice, we think about someone who, they only have a few days left and they're about to pass. And the reality is that hospice can last for much longer. And it plays a very important role because its focus is on comfort care. You're not necessarily trying to heal the person. Now you're just trying to aid them in the dying process and make them as comfortable as possible, and that's something that Medicare does pay for. So those are two instances where someone can be residing at the nursing home. They're physically at the nursing home, but they're not considered a nursing home resident. They are a rehabilitation patient or they're a hospice patient, and that's why Medicare is paying the cost of their care. So what does that leave us with? That leaves us with Medicaid. Medicaid is an increasingly important government benefit because it is one of the few government benefit programs that will pay for the cost of skilled nursing home care. And with Medicaid, especially with seniors who have lived their lives independently and have worked hard their entire lives, and they say, well, I don't want to be on Medicaid. I don't want to be receiving these benefits from the government. Understand that the reality is the majority of residents in nursing homes are covered by Medicaid. 65% of all residents of nursing homes have their costs paid for by Medicaid. So what is Medicaid? Medicaid is a safety net program. So it's intended to provide medical care for the poor, for individuals who simply don't have the means to cover the cost of their care. And it's a needs-based program, which means that there are going to be asset and income limitations in order to establish eligibility. So that's where the elder law attorney comes in to assist families to try to navigate the complexities of Medicaid, to find strategies where they can help establish eligibility for Medicaid while protecting the life savings that the senior has worked so hard to pull together. So I hope you found this information to be helpful as we're discussing the ways that individuals can pay for long-term care. Please understand that this is general information and is not intended to be providing specific legal advice for your individual needs. And if you or a loved one is facing the task of trying to find a way to pay for long-term care, please feel free to call, and I'd be happy to discuss your situation with you to see if there's anything that I can do to be of assistance. Thank you.